Uh, Good evening, ladies and gentlemen. For those of you who doesn't know me, I'm Pabling Chu, diagnosed as diabetic since 1988, and I am an open heart bypass patient 15 years ago, and still a chronic dialysis patient for 7 years now, and just recently an above-the-knee amputee. Now, I'm taking Purtier not because I expect that I will bring back my leg, and not to cure my kidneys or my renal failure, because the only cure for my kidney is a kidney transplant. And I take Purtier now. I've been taking Purtier for 6 months now. Almost 6 months. And I started with 4 tablets daily, and then reduce it to 2 tablets because of my situation. Now, it is already helping me go through my weekly dialysis, because during dialysis, a patient is always monitored with a lot of vital signs, irregularities of the blood pressure, heartbeat, breathing, and all these things, and it should be in a level of tolerance so that you can go through one session of dialysis. And there are times when if these vital signs are not controlled, dialysis is totally terminated because a patient is unfit for dialysis. So the patient will have to suffer more. Now, in my case, it is helping me go through my weekly dialysis with the hope that maybe someday the frequency of my dialysis will be lessened from 3 times a week to 2 or maybe once a week, but not to treat my renal failure. And then, since I'm an above-the-knee amputee, doctors call this an ATK amputee, above-the-knee amputee. My movement here is no longer like a normal person. An ATK movement is very difficult, different from below the knee amputee, much more to a normal person. Because every time I transfer from a wheelchair to sit in my car, I have to use my 2 arms. I'm so dependent on my 2 arms. And before, I need assistance of another person to put me inside the car, and then outside the car, back to my wheelchair. And because I've been taking Purtier, I've been moving around, going into my, to sit in my car, vice versa to the wheelchair, from the wheelchair to my bed, and back without any assistance at all. And I am very dependent on my 2 arms, because I need my 2 arms to really drag the whole of my torso to move around from one end to the end of my bed. Now, it is giving me more strength, more energy, and it brings back my vitality to do all these things, because before, after doing this on a daily basis, I have to catch my breath, and my blood pressure is always up every time I do these things. But now, my pulse rate are controllable, my blood pressure also always 120. I am controlling all these things because they have a Purtier. Now, I will continue to take Purtier as long as I can, because it is giving me strength, energy, and vitality, and I hope that it will help me feel better to live the rest of the remaining years of my life to the fullest. I'm feeling better, healthier, in spite of my situation. God bless us all.
Thank you.